What pathology do you see in this image? If you guess greater trochanteric bursitis, I understand why. This image is actually representing anisotropy of the gluteus medius tendon, which is making the tendon look falsely hypoechoic. It's easy to make this mistake because the gluteus medius tendon is located adjacent to the greater trochanteric bursa on ultrasound. The greater trochanteric bursa covers the posterior facet of the greater trochanter as well as the insertion of the gluteus medius tendon on the lateral facet of the greater trochanter. When the sound beam is not perpendicular to the tendon, it can cause anisotropy artifact and can mimic greater trochanteric bursitis at this location. How can you avoid this pitfall when performing your MSK ultrasound of the lateral hip? When you're evaluating the greater trochanteric bursa for bursitis and you get an image that looks like this, you should rotate the transducer to see if the hypoechoic structure elongates like a tendon should before you make your diagnosis. This will help you differentiate anisotropy of the gluteus medius tendon from greater trochanteric bursitis. Bursitis will appear as a rounded, simple, or complex fluid collection that does not elongate, whereas a tendon can be elongated into a straight structure on the screen. There is also a subgluteus medius bursa where fluid can accumulate. If you've determined that it is a tendon and not bursitis, you should eliminate anisotropy of this tendon before storing any images. The trick is to elongate the tendon and heel-toe the probe until the gluteus medius tendon is as straight across the screen and as echogenic as possible. You cannot correct true tendinosis and make it appear echogenic. If a tendon is artifactually hypoechoic, it will be difficult to detect tears, so you must correct it to provide a diagnostic exam. In this case, when the transducer was properly aligned with the gluteus medius tendon and anisotropy was eliminated, a partial thickness tear was visualized where the gluteus medius tendon inserts onto the greater trochanter. These pathologies are both common causes of lateral hip pain. It is common for greater trochanteric bursitis and gluteal tendon pathology to coexist, but it's important to be able to differentiate these findings from each other on your MSK ultrasound exam. Hope that helps.